Good afternoon. Thank you very much for coming. I will try in 20 minutes maybe to convince you that this extract, which is deriving from a citrus species, which is bergamot, represents today maybe one potential solution for targeting cardiometabolic wellness. It is known that the cardiometabolic risk is one of the major factors which may affect the development of cardiometabolic disorders such as myocardial infarction and sudden death. And we expect that in 2030, we can account for 22 million deaths for cardiometabolic disorders. So it's a huge problem which has been approached in different ways, especially on the basis of the information we received from pathophysiological studies in which it has been demonstrated that cholesterol obviously is the major player which leads to the plaque formation and to the development of myocardial infarction. However, and we know that today we have also excellent drugs which may produce the benefit of reducing serum cholesterol lower in a condition lower than 50 milligrams of LDL, which is the due target in order to produce also a regression of the plaque. However, if we look at the number of subjects which are undergoing myocardial infarction, we can see that no more than 52-53% display high cholesterol. And you can see that we have a series of other components which contribute in the so-called non-cholesterol risk for myocardial infarction and sudden death. So this means that we have a huge part of the cardiometabolic risk which is not completely related to the serum cholesterol. And we studied and we realized that alongside with an additional effect on serum cholesterol, we need to target other components of cardiometabolic wellness, which are inflammation, oxidative stress, and alteration in platelets and coagulation. So we do believe that a series of natural extracts may contribute to produce a benefit. However, to date, not many of these products are able to cover the global cardiometabolic risk. And you can see that derivatives from oleoeuropea, polycosanols, statin, silymarin, niacin, other berberin have been accounted to produce benefits in many of the steps leading to the pathophysiology of cardiometabolic disorders. However, we have no evidence that those products may produce benefit in terms of reduction of cardiometabolic risk. In the last 20 years, we studied the polyphenols which are contained into this specific citrus species, which grows spontaneously in the south of Italy, and which is characterized by very high content in polyphenols, but full spectrum capacity to produce antioxidant and anti-inflammatory responses. And I will try to show many of the data which have been collected in more than 74 papers published into top-ranking journals, and 16 clinical trials in which the efficacy and safety of this product has been proven in patients. And as you can see, the activities are concentrated in a full spectrum protection beyond cholesterol. The peculiar antioxidant and anti-inflammatory properties, the effect on metabolic syndrome and NAFLD, and mostly related to interaction with dysbiosis and with alteration of microbiota, and the activity, especially in postmenopausal discomfort, which are accompanying the reduction in biomarkers of dyslipidemia. And finally, I will try to show you data in which there is a comparison with red yeast rice and the potential for statin-induced side effect. So the activity against dyslipidemia have been demonstrated in many papers published in top-ranking journals. You can see scientific reports of Nature, International Journal of Cardiology, European Heart Journal. In these studies, we demonstrated that we have a peculiar composition in polyphenols on BPF, not only from the quantitative point of view. We have a very high concentration in the fraction of BPF. However, we have several polyphenols, such as the glycosylated polyphenols, which may counteract the endogenous biosynthesis of cholesterol in a statin-like effect, but without the side effects which are accompanying the use of statins. And this effect is accompanied by a very powerful inhibition of oxidative stress which are accompanying the vascular injury. And if you can look at this picture, you can see that in the middle, the vascular injury is accompanied by accumulation of nitrotyrosine, which is the footprint for the formation of free radical species in blood vessels. And you can see that BPF is able to counteract completely the formation of free radical species in the vessels, thus leading to the conclusion that this effect is antioxidant as is antiproliferative in blood vessels. Then we have also vasoprotective responses, which are related to a series of activities which have been discovered in the last 20 years. In particular, we have the enhancement in the release of nitric oxide. You know, nitric oxide is the most powerful vasodilator, endogenous vasodilators, and contributes in maintaining the blood clean without the tendency of formation of thrombs and to platelets to aggregate. So this means that this peculiar activity is the one we have found in 100% of patients taking BPF. And this effect is the one accompanying the anti-dyslipidemic responses we can find with the product. This is the only product in which we have not only reduction of LDL cholesterol and increase in HDL cholesterol, but we have also the reduction of the triglycerides and reduction of fasting glucose. And all those effects are leading to the benefits you can find in patients with metabolic syndrome. This is the paper which has been published a few years ago in subjects with NAFLD, in which we demonstrated that not only lipid accumulation is inhibited, but we have also the inhibition in the inflammation and steatoinflammation, the NASH, which is the one which characterizes after a prolonged period the accumulation of lipids and the metabolic syndrome. This is also has been described in diabetic patients. So which are the peculiar reasons why this product is able to produce widespread responses in vasoprotection and in counteracting cardiometabolic risk? We believe that the interaction with gut microbiota is the key mechanism. As you know, microbiota and dysbiosis are the major regulators after the development of dyslipidemia and metabolic syndrome, which lead to the release of endotoxins in the blood of patients undergoing metabolic syndrome. And this is a crucial mechanism, as endotoxin reduce nitric oxide. And this effect is counteracted by the supplementation of patients with BPF. And you can see here that LPS, which is elevated in dyslipidemic models in rats and in patients, the so-called low-grade endotoxemia is the key mechanism leading to myocardial infarction and stroke. And you can see that this effect is dose-dependently inhibited by BPF in rats. This effect is also accompanied by improvement in the global wellness. And the example is represented by the studies we have carried out in perimenopausal, postmenopausal period in women. Women with metabolic syndrome and dyslipidemia develop also changes in mood disorder, which enhances and potentiate the disturbances which are characterizing menopause. And these are the patients we studied, are around 300 ladies which were monitored due to the metabolic imbalance and metabolic syndrome, and have been treated with 1 gram daily of BPF. These are the general characteristics and the effect on metabolic parameters. You can see that all of them have been improved after 12 weeks of treatment, and the women have been also evaluated through a menopause rating scale, which is the one used worldwide for detecting the parameters accompanying menopause. And you can see that hot flash, sleep problems, mood disorders, irritability, and sexual problems accompanying menopause have been all improved after the treatment with BPF. So this is a crucial aspect which combines potentiation and improvement of the protection against cardiometabolic risk and the improvement of wellness and mood disorders in menopause. Finally, we also evaluated the comparison with red yeast rice and statins. It is known that statins are the major drugs which are used in counteracting high cholesterol. And red yeast rice was used for a century in order to produce a natural extract which is able to have a mimic effect compared to statins. However, it is known that those compounds are accompanied by relevant side effects which lead to the interruption of the treatment after a certain period. Normally, in 1 year, those effects compare is alteration in muscles and pain, and increase and elevation of CPK in the blood. And these effects are related to the depletion mostly of CoQ10. And the reduced rice has been in the last few years in a landscape for the critical and serious issues related to the prolonged use of this product, and European Food Safety Authority reduced the amount of reduced rice which is required in order to produce benefits in patients. And to date, we are looking for products in order to substitute reduced rice. And here you can see that the series of issues which have been evaluated when substituting the red yeast rice. You have the same side effect of statins, but you have not the potency of statins. This is the crucial aspect. And we compared in a head-to-head study BPF with red yeast rice, demonstrating that there is a superiority of BPF compared to red yeast rice in terms of response in patients. And we have the additional effect that you have not risk for developing diabetes, which occurs with statins, statin-like products, and we have an improvement in vascular reactivity due to the effect of BPF on nitric oxide. So we can take into account that BPF is able to produce better responses compared to red yeast rice with no side effect or no one of the side effects which have been described also for red yeast rice. The final mention is to this study which has been published a few years ago in International Journal of Cardiology, in which we compare the effect of statins, and especially rosuvastatin, which is the top-ranking statin in terms of efficacy for the reduction of cholesterol, and we compare with BPF or in combination. The conclusion of this study is that we have a potentiation in the hypocholesterolemic response of rosuvastatin with the additional effect on triglyceride, which is unknown for statins, and we have an improvement of side effects which lead statin to be reduced in the dosage and to reduce also the side effect. So, in conclusion, nutraceutical supplementation may represent a valid solution for implementing the response of traditional drugs in counteracting cardiometabolic risk. We believe that in the area of nutraceuticals, BPF has the evidence and has been assessed to represent the most powerful natural resource to counteract cardiometabolic syndrome due to the antioxidant and anti-inflammatory responses. And this is also accompanied by improvement in liver function, improvement in mood disorders accompanying menopause, and also the natural resource targeting cardiometabolic wellness. And finally, we also found that BPF represents a valid candidate to substitute red yeast rice in combination products and to attenuate statin-induced side effect. This is acknowledgement for my group and for the international collaborations we have in this area. Thank you for your attention. Obviously, any more question may be well described in at the booth 3T193. Is any question from the audience? No questions? Okay, thank you very much.